Today is clinic day for 70-year-old Lois Miano and 29-year-old Levi Mutua. They are here at the Lions Diabetes Care Center in Nairobi to monitor their blood sugar levels and get a refill of their drugs.
I started growing very, very big and I was so plump. That was very unusual with me. Weight just came. And I was just lazy, sweating a lot.
Could feel thirsty. Nilikuwa nasikia njaa kwa wingi sana, kukunywa maji kwa wingi na kwenda kwa choo mara mingi sana kwa siku.
Lois comes from Nyeri County. She was diagnosed with diabetes type 2 in 2005. She has been on blood sugar regulatory medicines for over a decade now.
Yeah, that's why I'm saying it's not an easy task because imagine every day you have to swallow something. If you are not swallowing, if you are maybe like type 1, diabetes type 1, you have to inject yourself. And these drugs are not easy to get.
Levi Mutua suffers from type 1 diabetes. After every single meal, he has to inject insulin into his body.
First, it was a very big challenge for me because I was still a teenager. The injections were too painful for me. But within 3 months, I started getting used to injections.
There are two types of diabetes. Type 2 diabetes, also known as non-insulin dependent diabetes. It results from the body's ineffective use of insulin, meaning that the pancreas produces less insulin. Most people suffer from this type.
A lot of times it can be prevented, obviously, with a healthy lifestyle. So this is what I want to emphasize, that we need to prevent before it happens, and we need to adopt obviously a healthier lifestyle to be able to do this.
The other is type 1 diabetes, also known as the insulin-dependent type. It is characterized by the pancreas not producing insulin at all, which requires daily administration of insulin. It is mostly found in children and teenagers. There is also the gestation diabetes, whose blood glucose levels are above normal but below those diagnostic of diabetes. This type occurs between 24 to 28 weeks of pregnancy. However, women and their children suffering from this type are at a high risk of contracting type 2 diabetes in future.
Especially the patients who are obese, and because obesity is already a risk factor for diabetes anyway in family history. For the patients who have gestational diabetes, we do what we call OGTT, oral glucose tolerance tests.
Dr. Rilwan Aiden is a diabetologist at the Lions Hospital. She says that since the outbreak of COVID-19 in the country, the flow of patients visiting for checkups have reduced.
It's all over the media, and these patients are following the media and the media briefings on COVID-19. And they know that patients with diabetes are having this sort of outcomes with the viral infection. So coming to the clinics has reduced in these patients.
Even though the disease is manageable, patients still have to undergo some challenges.
It has cartridges, which you have to use like 3 or 4 per month. One cartridge is 1,500. So per month, you might find you are spending more than 7,000 or 8,000 on insulin alone.
The main symptoms may include excessive excretion of urine, thirst, constant hunger, weight loss albeit eating excessively, blood vision, and fatigue. Diabetes is a major health concern among people across the globe. The World Health Organization estimates that 6% of the world's population suffer from this lifestyle disease that has doubled up in the recent past. Even as the world celebrates the World Diabetes Day today, reports indicate that most people living with diabetes have developed mental health complications due to the constant news that they are susceptible to the coronavirus.
I would like the government really to try and include the diabetics into the list of those people who are treated free of charge. I know the pain. Unajua saa ingine inaisha katikati na sina mtu wa kunipatia pesa.
It's very expensive because for me, I spend like half of my salary on my medication.
Gigi Namagundu, K24 Evening Edition.